A decline in the numbers brought about the easing of restrictions. We asked Health and Human Services Secretary Mandy Cohen to tell us more about it. Thank you again for visiting with us, Secretary Cohen. Big day on Wednesday. Governor Cooper announced the easing of restrictions, and there are a lot of other things I want to talk about, but that's what everybody's interested in. Let's start with that. Do the drops in numbers, were they the reason why you decided to ease some of these restrictions?
Well, first, Tom, always good to be back and a chance to talk through some of this. And as I went through in our press conference today, we look at our 4 key metrics that we've been looking at since last April to really guide our decision making. And what we've seen is our cases have gone down. Our surveillance data shows that we're not seeing as much viral spread. We're seeing our hospitalizations way down from its peak. We're seeing our percent of tests holding steady. Now, I want to remind folks that our trends have definitely gone down and are heading in the right direction, but we've almost become numb to the numbers, and we are still high. We still are looking like we did back in October of last year, right? So that was before the holidays, before that peak. But so we've definitely felt like we could move forward and ease restrictions, but I want to make sure folks are remembering that we have work still to do here. We had another 3,000 new cases reported today. So this virus is still here, but we definitely are seeing positive news in our trends, which is why we felt we could move forward and ease restrictions.
Yeah, but after seeing 6,000 and 7,000 new cases per day, when you're seeing 1,500 and 2,000 per day,
yes.
You just, okay, things are getting a little bit better. Ooh. Let's talk specifics now.
I'm feeling better.
So far as easing restrictions are concerned, what's going to happen? What can we do that we weren't able to do before?
Well, I think the biggest thing is that the governor is lifting the stay-at-home order and the curfew at 10 p.m. So that is going for sure. And then we are easing restrictions on a number of settings and essentially opening all settings. Now they're going to continue to have reduced capacity at those settings, but things that had been closed, like indoor bars, are now going to be open, and other settings that were really capped at mass gathering levels, which is 25 people. We're now saying you can open at 30% with a cap of 250 people. So it is a big, I think, easing of restrictions. But again, I want to caution folks: it's not going back to pre-pandemic. We have to make sure to continue to wear our masks, continue to social distance, continue to wash your hands. You're going to hear that from me as we move forward. And the reason, Tom, is we do have that wild card out there. That's our variants, right? We're seeing variants in this virus that are more contagious and cause more severe disease. So we really have to be cautious as we move forward. But I think folks are going to be happy to see that we're able to ease these restrictions. We are certainly happy to do it. And I'm grateful that everyone's worked so hard to get our virus level lower so we could do this.
So let's talk some specifics, because I know our viewers are going to be very interested in this. Restaurants, for instance. Mm-hmm. Restaurants can have indoor seating up to 30% capacity? Is that right?
Up to 50%.
50% capacity.
Up to half capacity. Yeah, half capacity.
So that gets them more back to normal.
And yeah, that's right. And so before, we also had a curfew of alcohol sales at 9 p.m. We're raising that to 11 p.m. So a little more normal functions for them. But again, I want to remind everyone that still means wearing masks when you're at your restaurant, when you're not eating actively. I am concerned about activities where folks cannot continuously wear their masks when you're eating, when you're drinking. So those are the places where I still want a person to evaluate their individual risk.
Sure.
And say, is that a right thing for me and my family to do, or should we get takeout tonight? I want you to support the restaurants, but it's a matter of should you eat indoors or take it home.
Common sense, I think, is what you're saying. How about my sporting events?
That's
Can
right.
we go to high school and college and even pro baseball games and summer sports and so forth?
So we can do that. So they had been at a mass gathering limit, so really only like 25 or so folks indoors. For our outdoor venue, we are opening that at at 30% with no cap. Remember, we are less concerned about outdoor activities than we are indoor. So outdoor, we want folks, so if you want to go see your baseball games and your soccer games outside, those are great. Now, when we go to indoor, risk we know goes up when we are in indoor settings. So for indoor venues, we are opening to 30%, however, with a 250-person cap. But that should get, plenty of, particularly the family, close friends of all of our athletes in to be able to see those games. And for our larger indoor venues, those who seat more than 5,000 folks, they are able to open with more capacity than just that 250 cap. They're able to go to 15% capacity, so they're able to do a bit more because they have more infrastructure to make sure they're monitoring folks, about masks and social distancing.
I remember last March when they had to call off the ACC basketball tournament. That's a big deal in North Carolina. And so
It is.
still won't be having the ACC tournament the way we're used to it, but we're getting closer. Is that it?
I think that's right, but I want to remind folks that the kinds of clusters of virus spread that we've seen have often been in athletics and have started there. So we are continuing to recommend limitations on indoor sports for our amateur athletes, college and professional, they're able to put in additional protocols. But we continue to see viral spread, particularly in high school indoor sports, tends to be where we're starting to see if there's viral spread in a school, it starts often with the athletic department. And that makes sense. They're working hard, they're close together, they're indoors, and that's where virus spreads. So we are continuing to recommend, against doing that because we really want to focus on getting kids back in the classroom and keep virus out of the schools.
I know you and the governor have been following the science and respect and appreciate that. Should we infer from this that this virus is on the way down, that we are moving back toward a new normal?
Well, I definitely think we're moving in the right direction. Part of this is that we've been working hard past the holidays to, make sure that we are doing the 3 Ws. So that's certainly part of it. Second is we're getting vaccine out there, right? We are in a different place than we were back in October. Now, our trends look like like they were in October, which I wasn't happy about, but we're back there, which is good. But remember, 3,000 new cases in a day is still a lot of virus here, but we're in a different position because now we have vaccine, and that's great. And we've gotten over 2 million doses. I think we're almost 2.2 million doses of vaccine in arms. That means more than 1 million people have gotten at least one vaccine already in North Carolina. So the combination of our prevention, the vaccines, I think puts us in a position to be able to reduce and ease restrictions. But I want to emphasize to folks again that there is a wild card out there, and it's the changes in the virus, the variants in the virus. And that's something we're seeing more and more of each day. And so we're going to have to monitor that really closely to make sure that we don't see that more contagious virus really spread more here in North Carolina and then cause our trends to go in the wrong direction.
People have been asking, why are we seeing these drops? And there have been some explanations like we've finally gotten over the holiday peaks and so forth like that. Tom Frieden, who is the former head of the CDC, says it's not because people are being vaccinated. It's not because of changes in the weather or anything like that. It's that people have finally gotten the message they need to wear a mask. They need to keep physically distanced. Would you agree with him on that?
I do. I agree with Tom, and Tom and his organization Resolve has done some really good work here in North Carolina in partnership with us, and I do agree with that. I don't think yet it is the vaccinations at all that is causing the decrease in our trends. I do think that it is protecting those who are 65 and older who we've been vaccinating, which is good, but our epidemiologists here in the state agree with Dr. Frieden about the fact that this is really being driven by our prevention efforts, meaning wearing masks consistently, which is why even as we ease restrictions, that mask mandate for North Carolina stays in place.
Yeah, I think there will probably be a likelihood that like I say, people are going to just sort of relax a little bit, but they got to remain vigilant. Now, we passed the 11,000 mark in deaths last week. We said that 83% of these deaths came from people that are 65 and older. Many of them had been hospitalized prior to their death. Does the drop in the number of new cases signify to you that we're going to have fewer hospitalizations and maybe lower numbers of deaths going forward?
Well, that is certainly the hope. That hasn't borne out quite yet in our numbers, but remember, we are just at the beginning of getting folks their second vaccine. For example, let's look at our nursing home, which are some of our most frail folks. It's where we had a lot, unfortunately, of severe disease and unfortunately death. They just have finished getting their second vaccine. So I think we're just starting to see the positive impacts of it. We're seeing just the start of those trends that you're starting to talk about with lower death, lower hospitalization. But I hope to see that continue. Unfortunately, when I looked at our numbers this morning, we had 100 deaths reported from yesterday to today. That didn't mean that it happened overnight, but it was, it's over the last week or so. So we are, this virus is still here. It is still, unfortunately, can be deadly to some. So that's why we still need to make sure that we are protecting each other.
So we've had 842,000 cases that have been reported, people who've already had this virus. We've had 200,000 who have received their shots. That's about 10% of our population. But the big news this past week or so has been the delay in the shipment, weather-related delays mostly. Where do we stand on vaccine delivery?
Yeah, it was a bumpy week last week with the weather, and so that there are 2 vaccines we get every week, some from Pfizer and some from Moderna. So last week we didn't get any Moderna vaccine, and that's half our doses did not come at all, and then only some of our Pfizer doses came. So this week they are delivering it yesterday, today. They were delivering last week's, and then today, tomorrow they're going to deliver this week's. So this is a big week for our vaccinating providers. So they're essentially doing 2 weeks of vaccinating in 1 week, though we're going to try to give them a little more grace to get all of that vaccine out. And remember, we have a lot of second dose vaccines to get out as well. So our vaccinating providers are cranking this week, and we're working hard with them to make sure that they can handle the increased doses that are coming this week, because we did get behind because of the weather.
According to your department, we've had 2.3 million doses of vaccine delivered to the state so far. 1.9 million have been administered. There was a story, though, about the fact that there were some 2,300 doses of vaccine that had to be thrown away. Talk to us about that. That's upsetting.
Well, first, I want to correct. I think we've administered about 2.2 million of the 2.3 that we have gotten. So we are getting almost all vaccines in arms when we get them. And remember, we can't speed up those second doses. The second doses come when they come, right? They have to be on a schedule. So often we will get the second doses sooner. We have to hold on to them in order to give them on the right schedule, either 21 days or 28 days. So I just wanted to clarify that. But you can see there are about 2,000 vaccines out of that 2.3 million. Again, less than 0.1% of all of the vaccines that something happened to them. Either they were during the shipping or when they opened the package, things fall on the floor, like it happens. And so we do try to catalog that so that we understand what the wastage is and make sure that we're not seeing any patterns in that. But yes, we did see that there were a few doses that we have wasted. Obviously, our guidance to all our vaccinating providers is please do everything you can to avoid waste. This is precious. We do not want to waste any vaccine here, particularly if you're taking it out of the freezer for a big event. We know you can't put it back in the freezer. So we are definitely telling folks to you got to get those vaccines in arms. Keep wait lists of people who will, be on the other end of the phone and be willing to come in if you have a few extra doses. So as you can see by the fact we've only had 2,000 wasted, like folks are doing a good job of making sure they're getting vaccines in arms.
Some epidemiologists are saying that between the number of people who've already had COVID and supposedly have some immunity, and the number of people who are getting the shots, we may be in a situation in which we can get back to normal, so to speak, in mid-April. Dr. Fauci says it's probably going to be summer. What do you think about North Carolina? What's the forecast?
Yeah, April is too optimistic. That is not going to be possible, because I know that we will not have enough vaccines for everyone who wants it until the summer. So I think it's by the summer we will see more supply of vaccine, and that anyone who wants a vaccine will be able to get it. I'm hopeful in the summer, but a lot of things have to go right to get to that point. I want to reiterate the wild card here of the variants. I think we have to both understand, are the variants, spreading in this period of time before people get vaccines, but also to know from science, are those vaccines still protective against these variants? We also want to understand, for those who have had COVID before, how long does their immunity last? We know you get some immunity to COVID, but as the virus changes, how long does that immunity last? How long do these vaccines last? Are we going to need a booster shot for our vaccines? I think those are the things we want to just be cautious of. I do think that we are heading in the right direction. I do see by the summer for us to be able to get back to some semblance of normal. But that's why you're going to keep hearing me talk about masks, even as we get vaccinated, because we just have some more to learn here with the science. And I just want folks to understand that we're going to be learning here. But that's why I check back in with us as we learn this from the scientists that are doing those hard work, to understand exactly what risks are out there, so we can let everyone know.
We've heard some conversations, some stories reported about how the vaccines are being distributed. Specifically, there is some controversy about whether more populous counties are getting more than their share of vaccine, whether zip codes with wealthier people are getting more vaccines than others. Talk to us a little bit about this distribution system.
Yeah, so the way we have been allocating vaccines now for quite some time is really based on the population in a county. We're trying to get vaccine to all 100 counties. We base that allocation on the county population. So obviously bigger counties get more, smaller counties get less, but it is population based. We do make an adjustment for those who are serving more of our historically marginalized communities, our African American, Latinx, right, American Indian populations, but essentially it's population based. And then we support just a few additional events over and above that are specifically targeted to some of those underserved communities. So we use just a small amount of our doses to say, hey, we're going to have some particular events targeted at communities that are underserved. So that's how we do it. And if you actually look at the distribution across counties, it's pretty narrow. We've gotten pretty good. It's never perfect. We're always trying to tweak it here, but we've gotten pretty good at making sure everyone's getting their fair share here of vaccine. And the hard part is like supply is limited, and you know that, Tom, is we just don't have enough vaccines. Our vaccinating providers could do more vaccine. As I told you, they're going to do a double week in 1 week because they can, right? They can do more vaccine if we only had the supply. Right. And I'm excited that the FDA this week is going to be reviewing a third vaccine. So that, assuming that they approve the Johnson & Johnson vaccine, that's going to improve supply as well. So I'm excited that we're heading in that right direction.
Last time we visited, you talked about the efforts trying to get the African American and Latinx communities covered with vaccine. We know that they're about 22% of our population. They'd only been like 12% of people who had been vaccinated. Where do we stand on progress with that?
Yeah, well, this is one place I'm incredibly proud of the work we've done over the last number of weeks. So the week ending February 15th, if you look at our data, 23% of vaccines went to those in the African American community, right? You just mentioned there were 22% of the population. They got 23% of the vaccines for a week, which is great. We need to keep that up because we did not see that week over week prior, but that's what we should be seeing week over week over week. And it takes a lot of intention intentional hard work. And I want to say that, I'm proud of the team. We got recognized at the end of last week by Bloomberg News saying that we had the best race and ethnicity data to be able to drive our decision making. And we don't just collect it because it's nice to have so we can get an award, but it actually drives our day-to-day decision making on where to allocate vaccine, how to make sure that we are reaching underserved communities. So that data is really important. So I was proud to get that recognition for the state, and I think that we have a very comprehensive equity strategy here, and I commend our vaccinating providers for really embracing it and doing it's hard work because you have to do the extra work to get into underserved communities.
Our legislature passed a law, and we're going to be seeing schools reopening to students throughout the state of North Carolina. Teachers have been very concerned, saying that they don't really want to go back into the classroom until they get their shots. I know we just opened up the category where they can. Should teachers be moved up to higher priority to get the shots?
Well, as you said, Tom, now starting today, they are able to get vaccine, but the issue is supply is incredibly limited. And so we know it's going to take a number of weeks to get folks vaccinated. But what I can tell you is that looking at the data, and the governor and I, as well as the superintendents, we look at the data, and it shows here in North Carolina that if you follow the strict safety protocols that North Carolina has in place, that we believe that kids can be back in school right now. I do not think vaccination is a prerequisite for getting back into the classroom. I said that weeks ago. And I think what you're seeing is our school districts responding. We know that by mid-March, 96% of students are going to be in person. That's pretty good. So folks are heeding that call. They're doing the hard work, which it is. I know these protocols are hard with the masks and the screenings and the distancing and and not eating at the cafeteria and all of that. It's all hard. And I really appreciate the hard work of the teachers and the principals putting all these protocols in place. But with the protocols, being in the classroom can be safe, and we want to see kids back in the classroom. And I think the districts are responding to that. Like I said, 96% of kids are going to have in-person options by mid-March.
Not only is it important from the learning point of view, because I think most people will say that for a large number of these students, they're not learning at the same way that they would be or at same levels in class, but it's also an emotional stimulus to be able to be back in the classroom. Talk a little bit about the emotional issues that are arising because of not only being out of class, but the virus itself.
Yeah, we know that this has been such a hard year, right? If we adults are feeling it, we know that our kids are feeling it too, right? Our routines have been disrupted. We have this virus that can impact friends and family, and likely that our kids have seen friends and family members get ill, be in the hospital, and I hope they've come out the other side, but they've likely known someone who may have died from COVID, right? So it's a scary time, and I do think being able to talk to them about doing these protocols, protecting each other, but it's still being okay to be back in the classroom is good. And again, they get the support from their peers as well as their teachers. And remember, it's not just about the social emotional pieces, which are important, but it's where kids get often a breakfast and a lunch. And it's where our teachers can spot issues with depression or anxiety and connect kids to resources. So there's a lot of benefits of in-person learning. That's why the governor has made it his top priority in this pandemic to get kids back in the classroom. And so I know that we know how to do it safely. So I'm glad to see that happening.
I've been sort of charting kind of the path, because it was March 4th of last year, if you remember, that we did our very first interview. And at the time, I think we had 4 cases in North Carolina, 4 cases total. And we didn't have any idea how big this was going to be. And we're now at 11,000 deaths and 800,000 people who've had the virus and all of these numbers. So I want to try to put this in perspective. We got about 2 minutes left in our time together. Where we are now and how you see us going in the coming weeks. This is good news. Unlike sometimes we've met You've had worried looks all over your face. I see a little relaxation now. Is that the trend? Is that where we're headed? What do you think for the next couple of 3 weeks?
Well, I certainly feel very positive, right? Our trends are heading the right direction. We have 2 vaccines that we're getting out with, more than 2.3 million doses out already, and a 3rd vaccine on the way. That's terrific. However, I just don't want folks to completely let down their guard at this moment. I think we still have a few more months of making sure that we're doing the 3 Ws, protecting each other, so that 11,000 number doesn't become 12,000 or 13,000 in this period of time, right? When you see the light at the end of that tunnel, you're still in the tunnel. So just protect each other as we go. You see the light, but we're still in the tunnel. So wear your mask. Make sure you're social distancing. Look, we're easing restrictions, but I just want to make sure people don't, do things that we're going to risk their own health in this moment.
You can't let off the gas now.
That's right.
Secretary, as always,
right.
You are very good at helping us understand and explain what's going on, and we thank you again for being with us. We learned so much from you. And we will be back on March 10th with another interview with you, but let's give our viewers a little bit of a tease as to what they're going to see next week on COVID Uncovered.
You went through a Mother's Day, you went through Christmas, Thanksgiving, things like that, and there's one empty chair, and it really it hits home.
It's been almost a year since Chris Harward lost his mother to COVID-19. How the Durham man is honoring her life and the 500,000 other Americans who died due to COVID-19.